Kohlo, Yahweh, Bashem, Yahushai, Bashem, Rucha, Kadash. Double honors to the elder apostles of Great Millstone, as well as honor to the men under the elder apostles of Great Millstone. Shalom to the elect and those who hope to be of that number. This is an article from US Today News. America could soon be swimming in crown pharmakia. The shift from scarcity to surplus could bring its own problems. This is the meaning of the word surplus. According to Google, the first result that comes up from Google, definition from Oxford Languages.
Surplus. Surplus.
Noun. An amount of something left over when requirements have been met, an excess of production or supply. Adjective. More than what is needed or used. Excess. Yes, as a noun, the word surplus is relevant here because they've met their requirements for the pharmacia that the America needs. There's an excess of supply, but people aren't taking it up. This also means that it fits the adjective that surplus can also be, because it's also an adjective depending on how it's used. Since more than what is needed or used, there's more left over than what is needed or used. Well, that's because people have not been, the max uptake is low, and the government, your government, wants to increase the uptake of the pharmacia. So more than what is needed or used. More than what is used, like it's more than what is used. Let's say they got 50 million and only 10 million of them are used. That means there's more that have been unused, 40 million, than being used. That makes it a surplus amount of pharmacia they currently have. And the example sentence he gives is make the most of your surplus cash. So as a noun, an amount of something left over when requirements have been met, an excess of production or supply, there's an excess of the pharmacia. Adjective, more than what is needed or used. More unused than used of this for this crown pharmacia. So going back to this on US Today News, America could soon be swimming in crown pharmacia. The shift from scarcity to more being unused than used, causing what seems to be an excess of production, since less people are taken up, could bring its own problems. See, these things are just going to waste. Sorry, I'm just waiting for this video to load. Alright, bye.
How can you get skin happy 24/7? Aveeno with prebiotic oat is scientifically proven to moisturize for 24 hours, so skin looks like this, and you feel like this. Aveeno.
Can't skip the ad. This seems like some advertising for you know what.
Fully vaccinated people can visit with unvaccinated people from one other household, indoors, without wearing masks or physical distancing, as long as the unvaccinated people and any unvaccinated members of their household are not at high risk for severe COVID-19 disease.
Showing a lot of movement, because they are the weaker vessel. And Eve was the first to take the Pharmacia in America, and Eve is going to be the one pushing it, wanting it more than Jake. And when I say I'm referring to Jake, Jake is short for Jacob, and in this instance I'm referring to the males of Israel. Like the Eve is going to want it before Jake wants it. And since they know that Eve is the head of the household, you know, the woman encompasses a man and all that, she's going to want everyone else in the house to be injected the Pharmacia. So she's going to want you, if you live in their house. Let's say if you live with your parents, or if you live with your mother, because most likely, you know, a single mother household and that in J communities. Scriptures does tell us the women are the weaker vessel. In just 2 months, the US could be swimming in, forget it. In just 2 months, Babylon could be swimming in Crown Pharmacia with 500 million 0.5 or 0.3 millimeter doses expected to be shipped by then, literally enough to fill a 55,000 gallon swimming pool. As hard as it is to imagine now, as people frantically call, click and line up to get Pharmacia, the nation is close to shifting from a situation of scarcity to one of abundance. They got more than they need, or an excess of supply, should I say. It's not a switch that flips, but it's a sliding scale that happens differently, community by community, said Andy Slavitt, the White House senior advisor for the Crown response team. This is not something that will start at some magical day in the future. It has begun today, and it's something that we have to make sure we're addressing. With a plentiful supply of Pharmacia, there will be more urgency to convince the reluctant as in unwilling, not willing, to convince the unwilling to accept it, experts say. Otherwise, the abundance of Pharmacia will become a stagnating surplus that threatens to undermine the nation's ability to move beyond the pandemic. When we start to have more Pharmacia available, we're really going to be in bad shape, because what we're going to see is a lot of people who don't want to get Pharmacia, said Bernadette Bowden Albala, Dean of the Public Health Program at the University of California, Irvine. So far, about 18% of all Americans have been immunized against Crown. Bowden Albala thinks there will be Pharmacia surpluses in some areas as soon as early April, and you can see we're in March. So, in a month's time, Bowden Alba thinks there will be a surplus of Pharmacia in some areas. And the article goes on to say, then the challenges will start. If we've got whole states in this country that don't want to mask and don't want to socially distance, then I'm very concerned we'll have people there who don't want to be maxed either, she said. Messaging will matter, experts say. The easiest group to reach will be those who simply put it off because of the hassle to get an appointment. For them, the message needs to be that immunization is quick, easy and free, said Christopher Morse, an expert in health communication at Bryant University in Smithfield, Rhode Island. You want to tell them it's free and how easy it is to get an appointment, he said. Something like, in the time that it takes you to order a cup of coffee, you could be maxed against Crown. The message should not be, we've got tons of Pharmacia, because then people will be convinced they can put it off for longer, he said. Some people who haven't got jabbed, simply injected with the Pharmacia, simply haven't had the time or felt rushed to do so. Message about why it's worth their while will be needed, experts say. You might say, get maxed. Spend Easter with your family. Or a church, a harlot house, this is, one of those phony churches like T.D. Jakes' church, might encourage people to be fully pharmakeated so they can sing together, said Dr. Kelly Moore. Sing together and worship white Jesus. Said, well, he didn't say worship, white Jesus. Said Dr. Kelly Moore, Deputy Director of the non-profit Immunization Action Coalition. Younger people who don't necessarily feel at risk might be convinced to get maxed and to help others, but they might be more enticed so they can go out to the movies again, eat dinner with friends, or hang out in bars. I know in the UK that if you want to go to a music festival, a music venue like Glastonbury, you're going to need to be injected with the Crown Pharmacare, else you won't be able to attend the venue. They're going to be focusing, Sakya, they're going to be focusing more on the social impact versus the health impacts, Moore said. Mobile clinics, pop-up MAC sites, and public service announcements from local leaders will be important to reach those low-income communities of color that go into jail, Negroes, Latinos, and Native Americans, where pharmacare uptake has lagged because of access and hesitancy. The value of community health centers. For the most vulnerable Americans, these clinics are trusted, accessible, and vital to MAC's rollout. Such efforts have begun in some places, but they must ramp up, as in go up significantly, go up by a lot, as a greater percentage of the population is immunized, and the extent of the pharmacare reluctance or unwillingness becomes clear, experts say. In California, Orange County is sending 8-person max travel teams into homeless camps, jails, and other hard-to-reach populations. How about giving the homeless some food? They come in a van, no appointments required, and they max whoever is available, said Margaret Brady Hoft, Deputy Agency Director of Public Health Services. Dr. Rebecca Weintraub, Director of the Global Health Delivery Project at Harvard University, says such last-mile delivery channels need to be prepared. Okay, yo, this is a long one. Suck yeah. But you can see the politics of max hesitancy. Max hesitancy also overall also is falling. In September, 49% of Americans told the Pew Research Group they probably definitely wouldn't take the pharmacare. By last month, as in February 2020, that number had fallen to 30%, but that still leaves 75 million people who may not be taking the doses already purchased by the US government for use. Experts say at least 65% of people, and likely close to 85%, must be maxed to reach herd immunity. Will employers require max? Yes, they will. In the UK, new contracts are going to require you to have the Crown Pharmacare. And I would say no pharmacare, no thingy, but YouTube might take it down because I made a video on that and YouTube took it down. You know where this is going, man. Don't try to save a life. Well, not this scripture, but the other scripture. You should not make any cuttings in your flesh for the dead, nor print any marks upon you. I am Yahweh. There's stuff constantly of you. And if you're not convinced by that scripture, Leviticus 21:5 doesn't make any mention for the dead. They shall not make baldness upon their hair, neither shall they shave off the corner of their beard, nor make any cuttings in their flesh. No cuttings, no cuts or incisions, small surgical cuttings in the skin or flesh. Period. Okay, the Lord made herbs of the earth for healing. He that hath need of them will not abhor them. He'll use them if he needs them. He's not going to stay away from them. So I'm going to leave it there. Hopefully this video was edifying. Until next time, Shalom.